Good morning. I'm Karen Warder from Family Care Network. We are a group of family practice providers up in Whatcom County. And
you know what? I'm going to just adjust.
Can they hear me?
Let's I'm going to adjust this just a little.
Thank you.
Does that help?
If I talk, maybe
Yeah.
that helps.
Or
Are we good?
Is that good? Okay.
So we are up in Whatcom County, and we have 64 physicians and 13 mid-levels. We are laid out throughout Whatcom County. We have several clinics. 4 of them are rural health, and the other 5 of them in Bellingham are not rural health clinics. We also have a medical testing center and urgent care facility. And then we have physicians that we have in a inpatient services program. We are not part of the hospital, so all of our billing is on the professional side, and our physicians only see Family Care Network patients. We began our journey about 3.5 years ago, early in 2011, preparing for ICD-10. So today I just want to walk you through the process and focus on these areas that you see on this slide. The first thing was our risk success analysis, then provider engagement and leadership buy-in, documentation, coding education and training, revenue cycle metrics, challenges, and recommendations. So the first thing we did to start preparing for ICD-10 is we designated a project manager. And our project manager gathered a team of co-workers within the organization, some management level, some billing folks, just to try to get input from all areas of the organization. And we just started looking at where does ICD-9 live now. There's pieces of paper in somebody's desk drawer. There's documents saved on desktops. There's many places where we save ICD-9 little notes to ourselves and how to use them and how to make sure that they match up with the correct services. So as we were going through that process, we just started thinking about what is the impact that ICD-10 is going to have and what areas will it impact. So the first main thing that we thought about was documentation. All of the physicians and mid-levels will need to be aware of documenting in more detail, as Michelle talked about, right, left, special details that allow us to give us that specificity to choose the proper ICD-10 code. For labs, we have patients that have standing orders for labs, and so what process do we need to implement to make sure that on October 1, someone who already has a standing order for a lab can go have that lab work done, and that the claims will be processed appropriately. In our clinical area, referrals, knowing proper diagnosis codes, and also for prior auths, what are the proper codes that will be accepted by the insurance carriers and their systems. Code sets, we're familiar right now with preventive services typically match up with a V code diagnosis. Well, what we know today as a V code is not going to be the same in ICD-10, and so we'll need to get familiar with some of those little tricks and what types of things match up together. Billing policies, and Michelle also mentioned just LCDs and NCDs from Medicare. What services are going to require a waiver, and what does that diagnosis look like in ICD-10, just to make sure that we're prepared to communicate to our patients that they're receiving a service that may not be covered, and if they still want that service, they would need to sign a waiver if they wanted to continue. Our management will need to look at communicating with our vendors to see if our systems will be ready. We may even need to talk about payer contracts. If you have any reimbursement that's based on diagnosis codes, we'll need to make sure that all of those things are in line. And consider budgets. Are we going to need more staff to be able to carry out this process? And then the last thing that we looked at is the phone calls. We have people answering the phones either in the billing office or in the clinics. They may not work directly with coding and billing, but for example, we have a patient portal. And so October 15th, patients looking in their portal account and they see this diagnosis that looks different, there's going to be questions. People are just curious. People are online viewing things, and they have a lot of questions to ask. So we just want to make sure that everyone in the organization is aware that this change is happening and be prepared to be helpful. So kind of some of the big areas that we were looking at as we went through this process is first our vendor readiness. With our EMR and our practice management system, when we were preparing for 5010 implementation, we received our upgrade a week before go live. And we really had no idea what our system was how it was going to process and what to expect. And so probably like most of you, we just went with it and did the best that we could. I think that was a typical thing happening at that time. There are so many initiatives happening, and the vendors can hardly keep up with everything. And so looking forward for ICD-10, we would like to be much more prepared and have a better idea of what it'll look like. In our EMR, we have a problem list on each patient's chart, and we would like to put some work into populating ICD-10 codes ahead of time so that when patients start coming in October, it's easy for the physician to select the correct code and make it a little less time consuming. So we had some concerns about how do we implement that. We also were wondering about the Big Bang approach. You know, anytime we have a new service in our organization, we like to roll it out one clinic at a time, kind of test it out, work out the bugs, and then move on to the next one. Well, we won't have that option when this happens. October 1, it's everybody. So we'll just try to prepare for that in a complete approach across the organization. And there is some concern about reduction in productivity. Will the providers be able to see as many patients, or will they be spending a lot of time and long hours documenting and trying to get familiar with the new code sets and how to select those codes? And then also payer readiness. Will the payers be ready to process the claims and be able to make payment? So after this evaluation, we met with our leadership and we talked about these very things that I just mentioned. And kind of the biggest concerns were, will our system be ready? Will we be ready as an organization? And then will the clearinghouses and the payers be ready? We all have a big part in this, and it's a lot of pieces that have to be put together in this puzzle for it to work properly. So after we presented it to our physician leadership, they of course saw that it was obvious that this was an important project and something that we needed to assign resources to. And so we were supported in moving forward. So today I can say that we are much more optimistic about some of those concerns. Our vendors, our system is to be, we're going to have an upgrade next spring, and so we will be able to start looking at what exactly, what it will look like in the problem list, how will the system act, and we'll have an opportunity to do some work ahead of time. We've worked within our organization just trying to increase staff and prepare for several projects related to ICD-10. And then also I've been involved in the One Healthport Collaborative, and so I'm just very encouraged when I go to these meetings and I see how engaged the representatives are from clearinghouses, payers, other organizations. I've learned so much, and I'm feeling confident that we are all going to be prepared to the best that we can. So things are looking a lot better than they were maybe a couple years ago when we first started talking about this. Regarding documentation, what we did is we gathered, and you see this in a lot of the checklists and the things that you should do to prepare, is we gathered the top 100 diagnosis codes that our providers use, and we started evaluating chart notes, and we just wanted to see, are we already documenting enough detail that we could assign an ICD-10 code? And for the most part, it looks pretty good. We have some feedback that we want to give our providers, and that we will continue to just remind them some details that would be helpful. We want to provide them quick reference lists within our EMR so that they can get to those codes quickly. But then the biggest project that we will do is the conversion of the diagnosis codes. Of our top 100 codes, we have found that 58 of them will be a one-to-one match. So when we implement this next upgrade, we'll be able to see an ICD-9 code and then the ICD-10 code for that same diagnosis. So it's the other 42 that we want to now focus on. So we will have a team of coders and billers throughout our organization that will work on different code sets and try to populate as many of those codes as we can, just to make that all simple and easy. Regarding our coding, actual selection of codes, education, we were able to send our project manager to the AHIMA ICD-10 coder training. And so she will be able to offer training for our organization internally. And I just think there's a huge benefit to that, if that's an option for you at all, because she's familiar with how we run things at Family Care Network. She's familiar with the workflow. And I just think there's a lot of additional information that she can give in the training that maybe an external auditor or consultant would not know. The next thing that we did is we met with the folks in each of our clinics and our patient accounts department who do coding and billing and just walked them through the code book. We talked about specific diagnosis codes, and we pulled out the ICD-9 code book, went to the alphabetical section, refers you to the tabular section, and you choose the diagnosis according to the coding guidelines. ICD-10 is basically the same process. There's going to be some different guidelines, but it's a code book that, even though it's huge and there's a lot more codes, when you're looking for one code, it's a very specific process that you go through to select the codes. So that really brought down the level of angst for our coders and billers, and it became a much more manageable task for them to look forward to. So beginning early next year, we will start doing a more intensive training with our coders and billers. We have a study book, and we're going to spend about 16 hours with this group of people. And then after that training is done, they will work in part of that EMR conversion that I keep talking about. So once we get to October 1st and we're moving forward and physicians are actually selecting diagnosis codes, we will have an external auditor take a look at our charts, just to make sure that our documentation does support what we're coding on our claims. So the next thing that we did was we put together some revenue cycle metrics. We just wanted to be able to watch for any place where there might be a backlog in claims, and we don't want to wait until 90 days out when all of a sudden there's no money coming in. We want to be catching any little problem that might come up along the way. So the first thing we did was we established a list of metrics, and I'll show you the metrics here. So we have a list of metrics, and then we established a baseline for each metric. So you'll notice here number 1 is patient registration, and you might think, well, what does that have to do with coding and billing? We know that there's only so much that we can control in this process, and so if we can make sure that the insurance is set up correctly on each account, as much as possible, then that's one less reason for a claim to reject or not process and pay. So we've put together a training program for that right now. And then as we move forward, we're going to be watching to see, provide the education for the providers to make sure that they know how to select the proper codes. We have a coding review desktop in our EMR, and so if a coder or biller has a question, they can send that to the desktop. And we will have, in this metric, a count of how many questions that we normally take in a week. If we're used to taking 20 questions in a week and all of a sudden we get 200, with 64 plus providers, that could easily be. Our 2 staff members aren't going to be able to manage that, and so we just need to be on top of how many questions are coming in so we can respond and get those answers back quickly. In our charge posting, we're just going to monitor the number of claims that come over. If all of a sudden half or 75% of the claims are coming over, there's a concern there, and we will want to go directly to the practice manager in that clinic and just see if we can offer any assistance of why there's a reduction. We keep track of how many claims we submit each day, so we'll obviously monitor that. We'll also monitor the rejections. We are hiring a full-time person that's going to work in the EMR conversion, and then the second half of their job will be to help work on the file rejections. I think no matter how much we prepare, there's going to be some denials through the clearinghouse that we can't anticipate. And so we will be staffed so that we can work those rejections, get the corrections done, and get the claims back out the door. We'll watch payments, make sure that the volume of payments stay up to what they have been in the past. And of course, watch the denials and appeals, make sure that we're clear, and make sure if appeal processes have changed at all, that we want to be sure how we can take the proper steps to appeal those claims. And we'll watch the aging, watch the percentages in each of those columns and make sure that they're not going up. And then the last one is patient billing. If for some reason claims are delayed for 6 to 9 months and a patient's getting a bill for something that was a service from 6 or 9 months ago, that can be frustrating, and so we want to have the ability to handle those questions and make sure that we're prepared to help patients that have those concerns. So in the metrics that we've developed, this will be more in the format of a spreadsheet, and for each of our facilities, what the counts are for each of these categories. And then one of the important columns is if you do see a deviation in any of the metrics, who do you notify? Who do you need to talk to make sure that we can make a change and improve things? We will have at least 2 to 3 months of revenue in reserves just because none of us have control over this whole process, and so there could be something along the way that doesn't work, and we just need to be sure that we're prepared. And I liked Michelle's comment that we'll prepare for the worst and hope for the best that it really won't happen. So some of the challenges that we've experienced along the way early on was just some of the issues with 5010 format changes and not really having any idea what to expect. We just want to make sure that we have plenty of time to test for ICD-10 and be much more aware of what that will look like. The second big challenge that we're currently facing is we've identified several people within the company that would be great to work with ICD-10 coding and work on this project, but they also wear, 7 other hats. And so at what point do you determine, okay, this is what they're going to work on now and stick to it, and then have to develop other ways for those other projects to get done? I think most of you, by the show of hands, are representing provider groups, and so possibly are smaller groups where you have a few people that are doing a lot of things. And so it's just really important to make sure that your staff don't go through burnout just because they're trying to do so many things. And I do, just after going through this whole process, I just have a few recommendations based on our experience. I would recommend that you focus on what you can control and not worry too much about the things you can't control. That doesn't mean don't educate yourself and don't ask questions, but as you're asking those questions and gathering information, don't forget to work on the details that you can change and improve on. If you have not seen an ICD-10 codebook, get one. Just where do you order your codebooks currently? Mm-hmm. Yep. Yep. They're usually in draft form. Just get the 2014. They're available now. And yeah, go ahead and get those. Just get a book and pull up a chart note and start coding it. And then, of course, read the guidelines in the front of your code book. But it's a very similar process to what you do now with ICD-9. And then I did provide a link here. I think this is a different link than one of the ones that Michelle had, but she has some great resources for you as far as how to get started. The 12-step checklist is a great way to start. And then also I would really encourage you to visit the One Healthport Information Central, and Bill's going to give us a little more information on that. But there's a lot of information that will be posted there. Really good questions. I find in reading the questions that are on the website and seeing the answers by the different clearinghouses and payers, it prompts me to think of other questions that I hadn't thought of yet. And so it's a really helpful way to get more engaged in this project. Thanks. So does anybody have any questions?
We have a few minutes where Karen can take questions. Teresa, do you have?
Can you go back one slide?
Yes. That one? I think there's a question in the middle front here.
Let me ask you to hold on one sec till Teresa brings the microphone. Good.
Hi. In what specific areas did you upstaff for this?
Currently, mostly in the billing office, and when I say that, that includes coding. So we're hiring one full-time coding person. Again, that's based on about 75 providers. We do have another clinic that's joining us in December, and so that's going to impact all of these metrics. You know, everything's changing, and I would guess that's pretty common. You know, you might have a new provider that's coming on sometime between now and next October, and so it's really important to bring them into your process, include them. And I'm sorry, did I answer your question? Okay.
She's coming right behind you.
I was just wondering what your high end and your baseline deviation is, or you guys figured that out, what that might be, or
I'm not sure that I understand your question.
you know, baseline deviation from your billing now to what your expected revenue cycle is, or any deviation from what you currently have, you know, based on,
To with ICD-10?
yeah.
We have not put a label on it in that way. I apologize, I don't have the answer to that. It's a good question. And the other part of this project that we have not moved very far on is the testing. I would encourage all of you to contact your vendors and anyone that you work with when you go through clearinghouses and just start talking about testing, or at least asking for results of their testing so that you can prepare.
Additional questions for Karen?
So I work for a jail, and so our situation is a little bit different. But is this coding going to include every facility regardless, or every practitioner regardless of insurance involvement or not? Or is it just related to people who are billing insurance who could be audited by the insurance companies? Or
Yeah, Michelle's nodding her head. In my understanding, the only payers that are not bound by this are the ones that are not covered under HIPAA, which would be like labor and industry and motor vehicle accident insurance. But I also understand that our Washington State L&I is very active in preparing for this.
Yeah. So if you are a covered entity and you currently use ICD-9 codes, you are required under the HIPAA regulation to use the ICD-10 codes. ICD-10 and the diagnostic code system is the only system that was mandated in the HIPAA regulations. So if you are required to comply with HIPAA, you are required to comply with ICD-10.
Additional, Teresa, there's also one in the back.
Is on One Health Board, are they going to be putting specialty specific top 50 or 100 codes or not in future?
I don't think One Health Board is going to be listing codes. It's more questions to the clearinghouse and to payers about how they'll process claims. And I think Bill's going to have more information about that later.
Hi, I work with a lot of behavioral health providers, and they currently use like DSM-4, DSM-5 for diagnosing. And I've been receiving some emails and stuff stating that ICD-10 coding is going to be expanded to include more mental health diagnosis. Do you guys have any recommendations of where I could find specific information regarding mental health transitions for the ICD-10?
Michelle, do you have any information on that?
So ICD-10 is expanding that. However, we do recommend for that particular specialty, you do contact your National Specialty Society, as they're going to really have their pulse on that. So I'm not really sure. We don't deal with a lot of behavioral health at the Washington State Medical Association.
Additional questions? Teresa, right here in front. She's coming right behind you.
I'm very lucky at the Everett Clinic, and we have about 40 behavioral health providers. I have a pretty good article on the mapping of the ICD-9 to ICD-10 and the improvements. I'd be glad to share that with Bill so we could get it posted out there.
Thanks, Janine.
Any last questions? Okay, please join me in thanking Karen for a great presentation. very much.